The UN says dozens of aid trucks have reached World Food Program warehouses in central Gaza. Trucks carrying flour, baby food, and medical supplies were being unloaded last night while armed guards fired shots into the air. UN officials said they were trying to get the desperately needed aid into the hands of Palestinians following delays due to fears of looting and Israeli military restrictions. Israel's army said 100 trucks crossed into Gaza on Wednesday, with more seen entering today. Well, food security experts say 500,000 people are facing starvation in Gaza. Many of Israel's allies have called for an end to the blockade of the Strip.
Aid agencies say the supplies allowed into Gaza so far this week fall way short of what's needed to ease the hunger crisis. And for those already displaced, the situation is desperate.
There is no flour, no food, no water. We used to get water from the pump. Now the pump has stopped working. There is no diesel or gas. The neighborhood is destroyed. The tanks are in our homes.
The UN's World Food Program is trying to get permission to bring in 100 truckloads of aid each day, but says even that would barely meet essential needs.
On the ground, the situation is growing more desperate, and the risk of insecurity and looting of humanitarian goods becomes even greater. As we speak, a bag of wheat flour costs $500 in Gaza.
The number of casualties from Israel's latest offensive is also rising steadily. Palestinian officials say hundreds of people have been killed since it began last weekend. Israel's military says its airstrikes hit more than 100 targets on Wednesday, including here in Jabalia.
We're afraid to sleep. Everyone is considered a terrorist, and everyone is targeted. Show me a house in Gaza that hasn't been hit.
Every day, people wake up to massacres here in Jabalia. The north of Gaza is destroyed.
Israel's Prime Minister says Hamas is holding 20 hostages who are still alive and up to 38 who are dead. He intends to bring them all home and insists there'll be no let-up in the ground offensive.
Our forces are seizing more and more territory to clear it of terrorists and Hamas's terror infrastructure. At the end of this process, all areas of Gaza will be under Israeli security control, and Hamas will be completely defeated.
While some aid is now getting into Gaza, agencies say distribution is a big problem and supplies are still not reaching the people who need them most.
And I could speak now to Dr. Fady Almadhoun. He's a medical activity manager with Doctors Without Borders and joins me now from Gaza City. It's great to have you on the show, Doctor. Now, the WHO says intensified Israeli ground operations and new evacuation orders are stretching Gaza's health system beyond breaking point. Tell us what that looks like in practice.
Yes, as you know, are totally collapsed after multiple evacuation. A lot of the people are crowded in the west of the Gaza. After evacuation, all of the north of the Gaza, most of the people are crowded in the tent without any food, any medication. All of the health system here cannot be able to support all of those patients. The hospital and health facility cannot be able to support the non-communicable disease, the wounded patients. The situation here is miserable after the blockage of the borders around Gaza for more than 60 days until now. Nothing entered the Gaza, no food, no medication, no medical equipment, no surgical equipment. You cannot be able to run your facility for the long period from now.
Your organization, MSF, had to be evacuated 9 times already. In those cases, what happens to the patients?
As you are, we have evacuation. We are start our work in the Shifa hospital. After that, we are evacuated to the Rafah. We are established modular field hospital in Rafah. After that, we are evacuated to the Nasser hospital. After that, we are returned to the Shifa hospital, and we are working in the Indonesian hospital and evacuation. All of these recurrent evacuation affect about the patient. We are trying during the evacuation to save our patient as much as possible, to make coordination and referral of those patients to the other health facility in the green zone, in the humanitarian zone. At the same time, we are trying to continue to support the health system here in Gaza and support all of the wounded patients during this miserable situation of more than 1.5 years of continuous war. Situation was miserable during all of the evacuation. We lose a lot of medication, we lose a lot of medical equipment, but still we are trying to support our patient according to our capacity.
Are there, at this point in time, any fully operational hospitals left in the Gaza Strip?
To be honest with you, in the Gaza Strip and in the center of Gaza, you cannot able to find more than 3 fully capacity hospital. Before the war, it was 34 hospital and large medical facility work. At now, a lot of them either destroyed, either not functioning because loss of the medication, because under the evacuation orders. You can imagine in the north of the Gaza, no hospital work at now. In Gaza City, just 2 to 3 hospitals are working. We are running our clinic here in the center of the Gaza. We are evacuated from the Indonesian hospital last time. Every day we are face a lot of a problem from the supply, from the multiple wounded patients come for us. You can imagine here, most of the people are stuck here in the west of the Gaza, more than 1,250,000 people, IDP, internally displaced person here in the center of the Gaza. We are trying to support them with the Ministry of Health, with the other INGOs. The situation is miserable, no access for the basic life, essential equipment and needs. Situation is very bad.
Give us a sense of the level of supply you have after no aid getting in for almost 3 months.
If the situation continue like that during the 3 to 4 weeks, we cannot able to continue like that in high quality of care. We cannot able to continue to support our patient because our stock running out day by day, week by week. The number of patients increase, the number of needs actually increase. All of the type of the patient we see always more and more complex and complicated wounds. Most of the people are burned, are injured during the bombing. All of those patients need continuous operation, continuous support, need to be admitted in the ICU. All of this are higher than the capacity of the health system here in Gaza. The situation day by day become worse and worse. By that, we are asking always to open all of the border to support the health system here in Gaza, to enter all of the medication, all of the foods, all of the medical equipment, just to support all of the died or support all of the system here in Gaza.
Aid trucks we're seeing are slowly entering Gaza again, and medical supplies are known to be among the cargo. What do you need most right now to be able to do your job and help people in need?
Actually, the most urgent needs for us and for the most of the INGOs and most of the medical equipments and medical material. We need for the drug, we need for the medication. All of the medical medication and medical equipment are running out or in the near of running out. Also, when we are speak about the fuel, no fuel here in Gaza. Also, the medical equipments for the running of the operational theater. Also, we are needed. Like a lots of the needs, a lots of things we are not have at now because of the long period of closure of these borders.
That was Dr. Fady Almadhoun with MSF in Gaza City. Thanks so much for sharing your experience with us.
Welcome.